iconic home in normal times, the place where we keep the rink out back, 30 Rockefeller Plaza, mostly vacant, bathed in blue tonight in honor of first responders in New York. And with that, good evening once again. Day 1183 of this Trump administration. 201 days to go now until our presidential election. And at today's White House briefing about the coronavirus, our president said today, quote, "People should have told us about this." Be that as it may, today he said our country has passed the peak of the illness. And by his thinking, as he put it today about our nation's population, still upwards of 80% of us indoors, America wants to be open, he said. Americans want to be open. The president and his people today unveiled their grand reopening strategy, which we will detail in a moment. After claiming total authority earlier this week, Trump now says it's up to the governors. It should be noted here, we have no idea how those poised to go back to work are going to be tested prior to going back to work. But as the president put it today, quote, "You have states with few cases, and those cases have healed. You have states without any problem and states with very little death." He says in places that reopen, quote, "As we see a hotspot developing, we'll be able to suppress it, whack it. Outbreaks will be put out quickly." Mike Pence got up and said with a Pencean straight face, "We've protected the most vulnerable. We have saved lives, and every American should be comforted by that." Trump later added, "Some states have gotten too much credit for what they've done." That brings us to today in reality. Our death toll as a nation tonight stands somewhat north of 34,000, with more than 667,000 confirmed infections out of the 1% of our total population that's been tested. And new data revealing COVID-19 is becoming America's leading cause of death. The White House new guidelines outline a three-phase plan for reopening the country, as the president puts it. Tonight, he deferred to the governors in terms of how to do it.
Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task.
Just days ago, the president insisted he would be the one to tell governors when they would reopen.
I have the ultimate authority. The president of the United States has the authority to do what the president has the authority to do. The president of the United States calls the shots. They can't do anything without the approval of the president of the United States. When somebody's the president of the United States, the authority is total.
The president hasn't laid out a specific timeline for relaxing restrictions. The White House suggests states should reopen only after states see a decline in confirmed cases over a 14-day period before taking the first steps.
Phase one begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place. We continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings and all non-essential travel. Phase two, again, we're asking for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals, and non-essential travel can resume. Phase three is essentially returning to our new normal with all of what we talked about through all phases, continuing the good hygiene practices, continuing the respect for spaces between individuals.
During the briefing, Trump indicated some states could start reopening as soon as tomorrow, while he conceded states like New York and New Jersey are going to be at this for a good long time. In fact, just today, New York Governor Andrew Cuomo, extended his shutdown orders for another month until May 15th. Trump's plan also says states need to ramp up testing for the coronavirus, but it doesn't include a national testing strategy. The government will help with access to tests, but states will be responsible for developing their own testing programs. Washington Post puts it this way. During Trump's call with governors today, quote, both Democrats and Republicans alike pressed him on the need for more broad testing availability. The White House was asked about its approach to testing at today's briefing.
Public health experts have said that this would be better done if there were comprehensive surveillance testing.
What is key in this is the early alerts and getting in there before they even know they have a problem. We do have enough testing capacity to do both that surveillance piece as well as the diagnostic piece and contact tracing.
There's two types of things: antibody tests and tests for the diagnosis of who has the disease. One you need for contact tracing, the other you want to need for finding out what's in society. We're going to have both of those much, much better as we go in the next weeks and months. And by the time we get into the fall, I think we're going to be in pretty good shape.
If we see a hotspot developing, we've learned a lot. We'll be able to suppress it, whack it. We'll be able to do things that people weren't even thinking about.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.